My name is Alycia Clark, and I'm a long-term trainee with the LEND program and a pediatric physical therapist.
So,
I'm here to share with you today about my LEND project titled Motor Development in Infants at High Likelihood for ASD, Findings from a Telehealth Assessments in the TEDI Study. This is my HRSA disclaimer. All the information and content here are my viewpoint and not necessarily that of HRSA's. Some background for this study to start off with. So, as many of you know, autism is a neurodevelopmental disorder characterized by primary difficulties in the areas of social communication abilities and repetitive behaviors. Increasing evidence shows that motor challenges are common in this population. We're also starting to see that motor delays are shown typically in toddlers and in elementary age children with ASD. Additionally, motor development influences multiple other areas of development. And so we see that motor development can influence social and communication development. And so identifying motor delays and having a comprehensive interdisciplinary evaluation is really important in being able to appropriately support this population. Unfortunately, we see that there's an inequity in who is able to access these comprehensive developmental evaluations. This is particularly true for populations in rural areas as well as those influenced by pandemic restrictions. So some gaps that we see in the current literature are that we see that motor delays are starting to be shown in young children with ASD. We don't see a lot of information on infants, particularly children before the 12 months of age. We also don't know how motor delays play out over time. And so we don't know if it stays the same, changes, gets better or worse. Additionally, there's limited knowledge on the effectiveness of developmental assessments via telehealth. So the purpose of our study was twofold. The first was we wanted to determine whether a motor assessment could be accurately completed via telehealth. And so our first hypothesis was that a gross motor assessment would show good inter-rater reliability when scored retrospectively from telehealth videos by two different raters. Our second purpose was to assess whether children or infants at high likelihood of ASD demonstrated motor delay before 18 months of age. We also wanted to see if motor delay was consistently present over time or changed in some manner. Our first hypothesis was that children at high likelihood for ASD between ages of 6 months to 18 months would demonstrate motor delays compared to children with typical development, and that this would be consistent over time. So a larger study that's been going on here at the Mind Institute is a study titled Telehealth Evaluation of Development for Infants, the TEDI Study. And the study is led by Dr. Talbot and Dr. Dufek, and the study focuses on assessing a parent-implemented telehealth assessment, particularly for social and communication abilities. And in this study, 30 infants have been are recruited, and they're at 6 to 12 months of age that are at higher likelihood for ASD. And so for the purposes of my project, Dr. Talbot and Dr. Dufek graciously allowed us to be able to add a motor assessment component to the study. And so that's where my project kind of fitted into this larger study. So to date, at the point of our assessments, we have 21 total participants, and participants were recruited with brochures and flyers, and some of these were also shared with pediatrician offices as well. And so we had 13 males and 8 females to date. At the initial assessment, the average age of children was just under 10 months of age, just under 10 months old. And children were included in the study if there were social communication or play concerns. The infant was 6 to 12 months of age at the time of the initial assessment. They were English speaking, had access to internet, and the parents were the primary caregiver. So 4 video visits were completed. There was the first one that was an initial assessment, and this initial assessment was then replicated 1 week later, and then was repeated 3 months post the initial assessment and 6 months after that initial assessment as well. During the video visits, each video visit was led by a psychologist, and they completed social and communication assessments. And then as part of the video visit, they had two different portions of time that were structured play-based time. And it was during this time that we added part of the gross motor component. And so we were able to look at how children moved during their play. And then if we didn't spontaneously see a skill, um, then the psychologist would ask the family to try and facilitate that skill. And so there were 60 video visits to date, and those video visits were randomly assigned between two different physical therapists, and both physical therapists completed the motor assessment tool for each of those visits. So the motor assessment that we used was called the Alberta Infant Motor Skills Assessment, or the AIMS. It's a norm-based assessment that is validated for use via telehealth, and it's used to look at gross motor abilities of children between 0 to 18 months of age. So then the statistical analyses that we used an intra-class correlation coefficient, a paired t-test, and we also made some motor observations. So results for our first hypothesis, we're looking at inter-rater reliability. And so this was actually previously assessed by a prior LEN project by Shannon Hoffman. And then we replicated it for this current project. And so 10 for both times, 10 of the videos were assessed by two different PTs. And then we looked at the correlation coefficient for the total AIMS scores between the two PTs. And we saw that for both cases, there was excellent inter-rater reliability, both above 0.9. Then we also looked at the total AIMS scores for the initial assessment and then replicated that initial assessment 1 week later. And we saw that there was no significant difference between the total AIMS scores from the initial assessment and 1 week later. And so we wanted to look at that to see if what we were seeing on telehealth and assessing was a true representation of the child. So for our second hypothesis, we looked at motor development over time, and we wanted to see how, whether a delay was present. And so what we saw at the initial assessment was that 55% of participants demonstrated a motor score that was below the 25th percentile on the AIMS. And then 3 months later, 46% of participants were below that 25th percentile. And at 6 months later, 42% were. And so we saw that about half of participants were scoring below the 25th percentile on the gross motor assessment. And this was largely consistent over time, although it did decrease slightly. We wanted to note that below this 25th percentile is clinically significant in that many children would qualify for early start services because it's considered a significant motor delay. So some motor observations that we made. The first was that we noticed that about 14% of participants demonstrated an altered crawling pattern. So they either crawled asymmetrically or scooted on their bottom. About 20% demonstrated W sitting, which is when a child brings their legs out towards the side and their knees kind of come in. And then about 60% demonstrated low muscle tone. So some implications for the study. The AIMS can reliably be administered via telehealth by different assessors, and this was consistent with previous findings. We also saw that motor delay was present in about half of our participants at 6 to 12 months of age at that initial assessment for those children at high likelihood of ASD. And some implications for this would be that a referral to early intervention would be beneficial. Additionally, this is consistent with the very limited literature that is currently out there about motor delays in young children. We saw the current literature shows about half of participants were also demonstrating a significant motor delay. And we also noted that motor delay in these infants were largely consistent over time. And we also noted that a large portion of infants presented with decreased muscle tone. And so one implication of this is that low muscle tone may be considered as a red flag to consider when screening for ASD. Some limitations to our study were that there was a small sample size and the study is ongoing. So there was inconsistent number of participants per time point. A lot of our participants at the initial time point were not aged yet towards that third time point. So we had less participants at that fourth time point, sorry. And then additionally, like I said, the study is ongoing. So some areas that we're still looking into is if there's a potential correlation between low tone and low motor scores, as well as if there's a connection between our gross motor assessment tool, the AIMS, with any other developmental assessments. I just wanted to give a special thanks to Dr. Mattern-Baxter and Dr. Talbot for all of their help and support with this project and just their guidance throughout this past year. So I just wanted to open up and see if there were any questions.
I have a quick question. This is Mary Beth.
Oh yeah, go for it.
Hi, Alycia. Are you guys going to continue following up longitudinally this sample?
Yes. So my mentor, Dr. Mattern-Baxter, is going to be, but I'm not directly, but they are still following up with children. Yeah.
Very cool. Thank you.
Yeah, thanks.
I have a question. This is Sally. Were the motor delays significant enough that the parents had seen them and reported them?
There were some that were reported, and there were some children that we knew were receiving physical therapy services already. It didn't necessarily come up every time in a conversation, but every once in a while, a parent would mention that during the assessment.